All right, today we're going to tackle the NGN NCLEX, but not by just memorizing a bunch of facts. No, we're going to learn to think like the exam. We'll walk through a real deal clinical case step by step, and I'll show you exactly how to use those clinical judgment skills you need to nail this thing. Sound good? Let's jump in.
So here's the plan. We're going to follow the 6 steps of the clinical judgment measurement model. Think of it as our roadmap. This isn't just some random review, okay? It's a system, a way to take a really chaotic situation and turn it into a clear step-by-step plan. And that's exactly what you have to do on the NCLEX. And, as a real nurse.
Okay, so let's meet our patient. This is Maria Lopez. She's a 68-year-old female who's come in with a fever, and she's confused. Now, her history is really important here. She's got type 2 diabetes, hypertension, some chronic kidney disease, and this is a big clue, a recent UTI. Keep all that in the back of your mind because it's going to be super important. All right, here are her initial numbers. We've got a high temp, a heart rate that's flying, blood pressure in the basement, she's breathing fast, her O2 is kind of borderline, and yeah, she's confused and barely making any urine. I know, it's a lot of information at once, and honestly, the NCLEX does that on purpose. Our job right now is to cut through all that noise and find what really, truly matters. And that brings us right to step 1, recognizing cues. This is all about filtering. We've got to look at all that data and pull out the pieces that are screaming danger. So what are the biggest red flags here? Okay, so that high fever, yeah, that points to an infection. But the stuff that's truly life-threatening right now, that's the low BP, the super fast heart rate, and the confusion. And you might ask, why those? Well, because together, they all just scream one thing: poor perfusion. Her organs, especially her brain and her kidneys, are not getting the blood and oxygen they need to survive. The history of hypertension? Good to know for sure, but it's not the immediate fire we need to put out. And here's a huge NCLEX tip for you. When you get a question with a wall of data, your first move should be to hunt for anything that points to a problem with perfusion, breathing, or airway. The ABCs. Things like a crazy low blood pressure or a change in mental status, those are almost always going to be your top priority. All right, on to step 2. Analyze cues. We've found the red flags. Now we have to figure out what they mean when you put them all together. This is the detective work part where we start connecting the dots to see the full picture. This kind of matrix question is perfect for this. See, sepsis isn't just having an infection. It's an infection that's so bad it's causing organ dysfunction. The fever, that's our infection, probably from that UTI she had. But the low blood pressure, the fast heart rate, and the fact that she's barely making any urine, that's the organ dysfunction. It's clear evidence that her whole system is starting to fail. Okay, let's go to step 3, prioritize hypotheses. We've connected the dots, now we have to give it a name. What is the single biggest, most immediate threat to our patient right now? And this leads us right into a classic next-gen question type, the bow tie. The whole point of the center part, the knot, is to make you name the one single condition that explains everything we're seeing. So looking at all the evidence, what is it? What's the main problem we have to fix right now? The answer has to be sepsis. It's the only thing that fits. It perfectly explains both parts of the puzzle, the infection, which we know she has, and all those signs of organ dysfunction, the low BP, the confusion, the low urine output. Everything points to sepsis. That is our #1 priority. Okay, so we've named our priority. Now we're on to steps 4 and 5, generate solutions and take action. We know the problem, so what are we going to do about it? And just as important, what are we going to do first? So here's the why behind these actions. In sepsis, the blood vessels get all wide and leaky, which makes the blood pressure just tank. So what's the fix? IV fluids. We got to fill up the tank to get that perfusion back. But, and this is key, before we give any antibiotics, we have to get blood cultures to see what bug we're fighting. And of course, a little oxygen to help her tissues out while we get the provider in the loop. Okay, but what can we do right this second? First, lay her flat. It's simple, it's fast, and it helps get more blood to her brain and heart. Easy win. Second, we're starting those IV fluids. That's the #1 treatment for this kind of shock. And third, we're going to be glued to that vital sign monitor to see if what we're doing is actually working. Yeah, bringing down the fever is on the list, but it's not as important as fixing that dangerously low blood pressure. And hey, here's a little tip that should help you breathe easier on exam day. The NGN NCLEX has partial credit. That means you get points for every right answer you pick. So it's way better to only select the answers you are 100% confident about instead of just guessing and maybe getting it wrong. The name of the game is safety. All right, we're at the final and maybe most important step. Step 6, evaluate outcomes. We did stuff, we intervened. So now we have to ask, did it work? Is our patient actually getting any better? And look at this. This is the payoff. After just an hour with those IV fluids, her blood pressure is coming up, her heart rate isn't racing anymore, and her kidneys are waking up and making more urine. This right here is what it looks like when perfusion is getting better. So whenever you get an evaluation question, you have to connect the result directly back to the problem you were trying to fix. Our problem was bad perfusion, right? So the signs of improvement have to be things that show perfusion is better. A higher BP, a lower heart rate, more urine. Her temp is still a little high, yeah, but that's not the immediate life threat we were tackling. That's getting better. Okay, so let's wrap this up. What are the big takeaways from this case? What's the stuff you absolutely have to know for the NCLEX? This is your NGN exam gold right here. First, burn this into your brain. Sepsis is infection plus organ dysfunction. Second, if you see low blood pressure and confusion together, it is always an emergency. Third, for sepsis, think cultures first, then flood them with fluids and start antibiotics. Fixing that perfusion with fluids is priority 1. And last, always connect how you evaluate the patient to what you actually did for them. And believe it or not, you just walked through all 6 steps of the clinical judgment model. You saw the problem, you figured out what it meant, you picked the biggest threat, you did the right things, and you checked your work. That right there, that is exactly what the NGN NCLEX is all about. But nursing never really stops, does it? So, to take it one step further, what's next for Maria? We've got her stable, but we're not done. What should we be anticipating? Well, we sent those blood cultures, so we should probably be getting ready to hang some broad-spectrum antibiotics, right? And as we finish up, I really want you to hold on to this one thought. The point of the NCLEX, and really the point of being a nurse, isn't about being perfect. It's about being safe. The NGN is designed to reward safe, solid clinical judgment. That's it. Hey, thanks for walking through this with me. Keep practicing thinking this way, step by step, and you are going to be more than ready. You've totally got this.